So hello guys, our today's topic is on subject dental histology. So let us discuss few important MCQ related to subject dental histology. The first question is fiber that is not attached to bone is. Well, the fibers that are not attached to bone, they are the transseptal fibers. These are the transseptal fibers you can see in this pic. Transseptal fibers, they are collagen fibers. They are not attached to bone, but they connect the cementum of one tooth to cementum of other. So here are these transseptal fibers. They connect from cementum of one tooth to cementum of other. So these fibers, they play a role in stabilizing the position of teeth within the dental arch. Other options, the first option is oblique fibers. So these are the oblique fibers. They run diagonally from cementum to the alveolar bone. So these fibers provide support and withstand the masticatory forces during chewing and biting. So many a times MCQ has been asked, what is the role of oblique fibers? They bear the masticatory forces. The horizontal fibers, they run horizontally from cementum of alveolar bone, cementum to the alveolar bone. So they are mainly responsible for resisting the horizontal forces acting on the tooth. So your answer will be transseptal fibers. Moving to next question. The stria of Retzius often extend from dentino-enamel junction to outer surface of enamel, where they end in shallow furrows that are known as pericymata. So pericymata, they are the shallow furrows or ridges on the outer surface of enamel. So they are result of incremental growth of enamel during tooth development and are commonly seen on the crown. So the stria of Retzius, they are pattern of alternating dark and light bands that can be seen in a tooth enamel under the microscope. So that lines provide the insight into the growth and development of the tooth. Now how these stria of Retzius are developed, let us discuss that. The process starts when the myeloblast, which are the specialized cells, secrete enamel proteins during tooth development. So a myeloblast don't secrete enamel continuously. They do it in rhythmic in cycles. So the dark bands represents the period of slow enamel secretion. So during these times the myeloblast might have been less active during the enamel formation. The other are the light bands. They represent the period of more enamel formation, that is rapid enamel secretion. So when the myeloblast, they are active depositing the enamel protein. So each dark and light band, it represents the increment layer of the of enamel depositing during one of each cycle. So sometimes certain events during the tooth development that can lead to prominent lines that are known as sinuated line of Retzius. So overall, the tooth continue to develop. These increment lines forms a unique pattern on the tooth surface. That is what we see as stria of Fredgers. So in the summary, these stria of Fredgers, they are formed due to the rhythmic secretion of enamel by the enameloblast during tooth development. So together these patterns provide a record of tooth development much like a tree ring. Moving to next question, the alveolar bone. Well, the alveolar bone refers to bone that surrounds and support the teeth. Within the dental sockets of the maxillary and mandibular jaw, so that play an important role in encouraging the tooth in their socket, and that is why they will provide support for the entire dentition. The alveolar bone, remember, it follows the slope of adjacent cemento-enamel junction. So cemento-enamel junction is a point where tooth enamel meets the cementum. So the alveolar bone indeed follows the contour and slopes of adjacent cemento-enamel junction. So the close adaptation of alveolar bone to teeth, it is important for tooth stability and function. So option A is right. Option B, it contains fibrous tissue. Alveolar bone, it is primarily composed of spongy bone and compact bone that provides structural support for the teeth. Option C comprises red bone marrow only. It is not accurate. Alveolar bone contains both the red bone marrow as well as yellow bone marrow. So red bone marrow is associated with blood cell formation, while yellow bone marrow, it is more fatty and serve as energy reserve. The option D regenerates easily after periodontal therapy. It is not generally true. Alveolar bone loss due to the advanced periodontal disease can often be irreversible to some extent. So that's not always true. So your answer is A. The pain response, the pulpal response is quick and sharp when carried by A delta myelinated fibers. So remember, A delta fibers, they are principally located in the region of pulp dental junction. They are characteristic by sharp pricking pain. So the sharp and pricky pain are the characteristic of A delta myelinated fibers. Whereas C fibers, they are distributed throughout the pulp and they have a burning, aching, less bearable sensations than A delta fibers. So this table is very, very important. A alpha fibers, their function is motor and proprioception. A beta fibers, their function is related to pressure and touch. A gamma fibers, A delta fibers, their function is related to pain, temperature, touch, etc. So remember all these value-based questions, and which has the fastest conduction velocity, it's the A alpha fibers. So remember that for your exam point of view. Moving to the next question. Osteonectin. The osteonectin, it is a glycoprotein found in bone and dentin. It is composed of various amino acids including glutamine and aspartic acid. So these two options are correct. So osteonectin, it is a glycoprotein in the bone that binds calcium. So it is secreted by osteoblast during bone formation, initiating mineralization and promoting mineral crystal formation. So option B, osteonectin, it is indeed found in extracellular matrix of bone and dentin. The predentin, it is the unmineralized matrix that exists before the dentin mineralization. So B is correct. Osteonectin contains sequence that can interact with cell surface and it is involved in cell matrix interaction. That is also correct. So all of the statements are correct. Answer is T. Moving to next question. The semanticals may dwell from, well, the semanticals, they are the small spicules or cementum. They are found in periodontal ligament or around the root of the tooth. It can dwell from various sources, including number 1, the calcified epithelial rest. These are the remnants of the Hartwig epithelial root sheath that is involved in tooth development. So calcified epithelial rest can sometimes give cementicles. The calcified thrombosed vesicles within the periodontal ligament can lead to formation of cementicles. Calcified sharpest fibers. The sharpest fibers are the collagen fibers that encourage the periodontal ligament to the cementum and the bone. So if these fibers, they become calcified, they can contribute to formation of cementicles. So answer is D, all of the above. The nerve fiber of the pulp, the answer is D. The nerve fibers in the pulp, they are not uniform in their distribution. Nerve fiber in the pulp are not evenly distributed throughout the entire pulp tissue. Instead, they tend to be concentrated in some area. The nerve fibers are more densely packed in the pulp chamber and less concentrated as they extend toward the pulp horns. So the pulp, it contains both the myelinated fibers and the unmyelinated fibers. The myelinated fibers, they have a myelin sheath, protective myelin sheath around them, and they tend to transmit signal more rapidly. Whereas the unmyelinated fibers lacks this myelin sheath and transmit signal more slowly. So the nerve fibers in the pulp, they act as both sensory and autonomic function. Sensory nerve fibers transmit pain and sensory information, while the autonomic, they regulate functions like blood flow and immune response within the pulp. So option A, mainly myelinated fibers, they have myelinated and as well as unmyelinated fibers easily damaged by inflammation. So answer is D. A group of gingival ligament running apically from the cementum over the periosteum of outer cortical plates of alveolar process insert into the vestibular muscles and floor of mouth. It is dentoperiosteal fibers. So dentoperiosteal fibers are the group of gingival fibers that run across cementum over the periosteum. and they insert into the vestibular muscles and floor of mouth. So answer is dentoperiosteal fibers. Which of following is hypomineralized structure in the enamel? Hypomineralized means there is lower mineral content in the enamel, making it less dense and more prone to structural issues. So enamel lamellae, they are thin leaf-like enamel lamellae, they are thin leaf-like defect or crack that extends partially into the enamel. They can be considered a form of enamel hypoplasia and are associated with localized enamel defect. The increment line of red gears, they represents the incremental growth pattern of enamel. Some of these lines may be hypomineralized or less mineralized and can be associated with enamel structural variation. However, the option B, C, D, they don't accurately represent the hypomineralized structures in the enamel. So Gnarled enamel, it is enamel with complex twisted pattern and it is not necessarily hypomineralized. Pericymata, they are not typically associated with hypomineralized structures. They are the shallow furrows or ridges on the enamel surface formed due to the increment enamel growth. Enamel lamella and enamel prism, they are the basic structure units of enamel and they are not inherently hypomineralized. So your answer is A. Next question, moving to next question. The matrix vesicles, they play an important role in mineralization of, well, the matrix vesicles, they play important role in mineralization of dentin, that is the hard tissue that make up the majority of the tooth structure beneath the enamel. The dentine, it is a mineralized tissue and process of dentinogenesis involves the deposition of minerals like calcium and phosphate within the dentin matrix. The matrix vesicles, they are the tiny membrane bound organelles that are involved in the mineralization process and attract these mineral ions and thereby formation and mineralization of dentin. So answer is dentin. During normal bone healing, osteoblasts, they are derived from monocyte precursor cells. Osteoclasts, on the other hand, are derived from periosteum and endosteum. Choose the correct statement. Option A, statement 1 is false because osteoblasts, they are responsible for bone formation. They are not derived from monocytes but from the mesenchymal stem cells in the bone marrow of periosteum. So option A is false. Osteoclasts, they are derived from hematopoietic stem cells in bone marrow and they are part of monocyte macrophage. They play a role in breaking down the bone tissue and not in its formation. So option B is also false. Answer is B. The fibers of periodontal ligament that provide the maximum resistance to vertical masticatory forces, they are the oblique fibers. They resist the masticatory forces. We have discussed that before too. So answer is oblique fibers. They run diagonally from cementum to the alveolar bone. So their diagonal orientation allows them to absorb and dissipate the vertical forces effectively. That will provide stability to tooth and prevent excessive movement under the vertical pressure. So when it comes to resisting vertical masticatory forces, the oblique fibers of the periodontal ligament, they plays a crucial role. Moving to next question. The function of the dental sac. So the function of dental sac is to provide nutrition. So dental sac, it is also known as dental follicle. It is a connective tissue that surrounds the developing tooth jaw. So one of its main function is to provide nutrition to the developing enamel organ and dental papilla that are the component of the tooth jaw. So this dental sac, it has a rich blood supply and the vascular network will ensure that enamel organ and dental papilla both receive the necessary nutrients for the formation and growth of the tooth. So dental papilla, it is basically a condensed mass of mesenchymal tissue that is located within the tooth. It is dwelled from ectomesenchyme that originates from neural crest cells. So dental papilla, remember dental papilla, it is responsible for giving dentine and pulp. So think of a dental sac like a protective hug around a developing tooth. It is like a support system that forms around the tooth and becomes the periodontium, that includes the periodontium, cementum and the alveolar bone. So the dental sac surrounds and creates structure that keeps tooth securely encouraged in your mouth. Moving to the next question, the maxillary sinus, it starts developing at the age of 3rd month of fetus. Maxillary sinus, they are the air contained spaces that occupy the maxillary bone bilaterally. So the maxillary sinus begins in the 3rd month of fetal development. So remember, maxillary sinus, they are the first of all paranasal sinus to begin their development during the embryonic growth. All of the following are the function of maxillary sinus, except they helps in mastication. They don't help in mastication. So the maxillary sinus do have several functions, including contributing resonance to the voice, protecting internal structures against exposure to cold air, producing bactericidal enzymes, and they do not directly play a role in mastication. Mastication involves the action of jaw muscle, teeth, and associated structures within the oral cavity. So answer is D. The secretory cells present in subepithelial gland of maxillary sinus, they are. So the subepithelial glands in maxillary sinus, they contains both the mucus and the serous cells. These glands produce mucus that helps to moisten and protect the lining of sinus. The mucus cells, they are responsible for producing a mucus with a thicker, more viscous consistency, while the serous, they produce a thin, watery secretions. Intermediate plexus, it is seen in the intermediate plexus. It is a network of intermingling fibers in the periodontal ligament. These fibers, they are located between the alveolar bone and cementum of actively erupting teeth. So they play a role in anchoring and supporting the tooth within the socket. Which of following fibers prevents the extrusion of the teeth? So it's the alveolar crus fibers. They are the group of periodontal fibers that runs from the cervical cementum to the alveolar crest. So these fibers are responsible in preventing the extrusion movement, that is the upward movement of tooth from the socket. So they help to maintain the proper positioning of tooth within the oral cavity by resisting the forces that causes tooth to move vertically. First evidence of TMJ development, it is seen at 10 weeks. So remember this. It was asked in your AIMS entrance exam. So remember this. Many a times this question has been asked. Hunter-Steger bands, they are best viewed in. They are an optical phenomenon in dental enamel due to arrangement of enamel rods. So when light is reflected on the enamel surface, it can reveal the characteristic pattern of these bands that results from crossing over of enamel rods within the enamel tissues. So these are they are best viewed in reflected light. The myoepithelial cells, they are seen in relation to secretory and intercalated ducts. Myoepithelial cells, they are the contractile cells associated in salivary glands. They are associated with both secretory acini and intercalated ducts. The intercalated ducts, these are the small ducts that connect secretory acini to the larger ducts. So what is the role of these myoepithelial cells? They play a role in expulsion of the saliva from acini into the ducts. So that aids in the movement of secretion through the salivary gland system. Dental pulp is derived from mesenchyme. The cell responsible for histological variation in pleomorphic adenoma are the myoepithelial cells. Pleomorphic adenoma, it's a benign salivary gland tumor. The myoepithelial cells, they are responsible for histological variation seen in the tumor. So these cells, they can differentiate into various structures, include the glassy, stroma, cartilage, bones-like structures, and fibrous element. So this variation is characteristic feature of the pleomorphic adenoma. The increment lines of Rutgers are seen in ground transverse section as concentric circles in the enamel, which resembles rings in a tree trunk. Already discussed. So these lines represents the rings in tree and are notable features in the dental histology. They represents the darkish or brownish band in the ground section and their concentric circular pattern is the distinguishing characteristic. In the transverse section, the incremental lines would appear as concentric circles. Sensitivity to pain is least likely to seen in the labial mucosa. So the labial mucosa is less sensitive to pain as compared to other tissues. The dental papilla is formed from, already discussed, it is formed from actin mesenchymal cells. So dental papilla, it is a condensation of ectomesenchymal cells. So they are responsible for giving dentine and pulp. So you can remember the mnemonic dental papilla. It consists of two words, one is T and other is P. So D will give dentine and P will give pulp. So dental papilla forms dentine and as well as the pulp. That is not a stage in life cycle of ameloblast. It's the matrix stage. So these are the stages: morphogenic stage, organizing phase, formative phase, maturative, protective, and demolytic. So your answer is D. The pulp, it contains which collagen fibers? The pulp contains type 1, that are the predominant, and type 3 collagen fibers. The non-keratinized epithelium, it is found over, the answer is gingival sulcus. The non-keratinized epithelium, it is typically found in area of oral mucosa that are more flexible and require greater adaptability, like the lining of cheeks, lips, floor of mouth, etc. Remember, as we know that the sulcar epithelium it is the epithelium that is lined by the gingival sulcus. So as we know, the sulcar epithelium is non-keratinized. So the sulcular epithelium, it is the epithelium that lines the gingival sulcus. So the non-keratinized epithelium, it is found over the sulcular epithelium. So few differences between the non-keratinized epithelium and keratinized epithelium are, in a non-keratinized epithelium there will be absence of keratin. Keratinized itself means that there will be presence of keratin. The non-keratinized has no stratum corneum, whereas the keratinized epithelium, stratum corneum is present. In non-keratinized epithelium, cells on the surface are living, whereas the keratinized, the cells on the surface, they are non-viable with the pycnotic or the no nucleus. In a non-keratinized epithelium, there is no stratum granulosum and keratohyaline granules, whereas in keratinized epithelium, there is stratum granulosum and keratohyaline granules. In the keratinized epithelium, as we know, presence of keratohyaline granules contains filaggrin and filaggrin protein. So there is aggregation of tonofilaments that leads to accumulation of keratin in the surface cells, that leads to keratinization of the surface. The keratinization oral epithelium, it is classified into 4 layers it is based upon their morphological appearance. So answer is B. So the 4 layers are stratum basale, stratum spinosum, stratum granulosum, and stratum corneum. So basal, it is the innermost layer of the, remember the basal, it is the innermost layer of the keratinizing oral epithelium. It is also known as basal layer. The cells here are cuboidal. or columnar in shape and are actively dividing cells. So they serve as the source of new cells for the layer above. The next layer is stratum spinosum. Above the stratum spinosum above the stratum basale there is stratum spinosum. So the cells, they are characterized by a prickly appearance. So they have desmosomes which are intercellular junction that provides the structural support to the epithelium. Above that there is stratum granulosum layer. In this layer there is presence of keratohyalin protein. So keratohyalin granules, they are present in which layer? Remember that it is the granulosum layer. So these granules, they play a role in maturation and hardening of cells. The outermost layer is the stratum corneum. It consists of fully keratinized, flattened and dead cells. So these cells, they are packed together, provide a protective barrier against mechanical stress, microbial invasions and dehydration. So we classify the oral epithelium into 4 layers based upon the morphology. The type of the tertiary dentine that contains cellular inclusion is found in osteodentine. So osteodentine, it is a type of tertiary dentine that contains cellular inclusions. So it is a dentine-like tissue that forms in response to injury such as extensive caries or trauma. So osteodentine, it can be found when there is vitamin A deficiency. So your answer is osteodentine. Remember, pre-dentine, option C, it is an unmineralized matrix that is produced by odontoblast. So it does not contain any cellular inclusions and it is composed of organic matrix that will later mineralize to become a dentine. Moving to the next question, the osteoclast, they are rich in alkaline phosphatase, in acid phosphatase. So osteoclast, these are, as we know, they are the specialized cells in body responsible for resorption of bone tissue. So osteoclast, they are rich in acid phosphatase. It is an enzyme that will create an acidic environment. So they will create an acidic environment in the resorption lacunae. So this acidic environment, it is essential for dissolution of the hydroxyapatite, that is the mineral content of the bone. So acid phosphatase helps in the breakdown of bone tissue during the resorption. Other is the alkaline phosphatase. It is an enzyme that is found in bone related cells like the odontoblast that are that are involved in bone formation rather than the bone resorption. So answer is A, acid phosphatase. The enamel cap on the occlusion surface of the primary molar is uniform in thickness of 1 mm. True about myoepithelial cells are they are found in the glandular. They are present in the salivary gland. They are most commonly known as basket cells. So myoepithelial, they have a structure similar to smooth muscle cells. They contain contractile protein, that is actin and myosin. So that allows them to contract. So their main role is to contract and expel secretion from the glandular structures. So option C is also correct. All of them are correct. The inorganic content of cementum, it is 45 to 50%. So 45 to 50% is the inorganic content, mainly the hydroxyapatite crystals that provides hardness and durability to the tissues. Which of following tissues has no reparative capacity? The answer is enamel. Enamel, it is the hardest substance, but it lacks the ability to repair itself. So once enamel it is formed during tooth development, it cannot regenerate or repair itself. So it does not contain living cells like odontoblast, which are responsible for the dentine formation, for the dentine repair. The fibrous elements in enamel, they are the keratin-like fibers. So these fibers are made of protein. So these fibers, they are embedded in the enamel matrix and provide what they do is they provide the structural support to the enamel. The epithelium of oral mucosa can be orthokeratinoid. That is found in, the orthokeratinoid, it is found in areas like hard palate and gingiva. The parakeratinoid, it is found in some regions like the lining of cheeks and some part of the gingiva. So it contains retained nucleus, whereas the non-keratinoid, it is found in area that require flexibility, like the lining of lips, cheeks, floor of mouth. It lacks keratin and it imparts flexibility. So answer is C. The normal pH of saliva is fall in the range of 6.2 to 7.6. So answer is merely 7.5. The connective tissue component of the oral mucosa is termed as, the connective tissue component is the lamina propria. This one is the lamina propria. It is located beneath the stratified squamous epithelium layer and play a role in supporting the oral mucous membrane. So this lamina propria, what will it contains? It will contain various blood vessels, nerve endings, immune cells that provide structural support and flexibility to the mucous cells. The primary buffering action of saliva is done by the bicarbonates. So saliva has bicarbonate signs that can neutralize the acid produced by bacteria in the mouth and helps to maintain a near neutral pH in the oral cavity. So this buffering capacity, it is essential for protecting teeth against acid erosion and maintaining the oral health. The percentage of inorganic matter in fully developed enamel is about 96%. The remaining 4% is composed of water and organic materials like proteins. Transparent dentine, it is best seen under scanning electron microscope. So it is best visualized under scanning electron microscope. The cushion in dental follicle, it is a connective tissue that surrounds the developing tooth. So it contains glycogen, so that act as a energy reserve. So your answer is glycogen. The secretory acini produced in serous acini, they are discharged by a process known as the process is known as exocytosis. So during exocytosis, the secretory granules they will fuse with the cell membrane, and their contents they are released into the ducts. Wheel zone of in the pulp, it is a cell-free zone. So wheel zone is a cell-free zone. So one is cell-rich zone, other is cell-free zone. Cell-free zone is known as wheel zone. What line is formed when the primary curvature of dentine tubules meet? It is the Hunter-Steger lines. So they are formed due to the so these lines they are formed due to the coincidence of the primary curvature of the dentinal tubules. So these are the Steger lines. The vitality of the pulp, it will depend upon the blood supply. The blood vessels within the pulp tissue, they will provide oxygen and nutrients to the cell of the pulp, including odontoblast, fibroblast, and the nerve cells. So answer is A. Vitality of pulp, it depends on the blood supply. The enamel, it is derived from ectoderm. Ectoderm tissue give rise to various structure in the body, including the skin, hair, nails, enamel of the teeth. So during the tooth development, enamel it is formed by a myeloblast. The specialized cells, they are derived from the ectodermal tissue. So these myeloblasts, they produce and mineralize the enamel matrix, and hence creating the outermost portion of the teeth. The dentinal tubules, they have a double curved course. So they have a double curved course starting at the right angle from the pulpar tissue. The primary curvature of the dentinal tubule forms the first convexity. As it progresses outward, it slightly curves in a different direction. So this doubly curved course, it is a characteristic feature of dentine microscopic structure. Components that are derived from dental sac is the cementum. Remember, dental papilla, it forms dentine and the pulp. And the dental sac, it forms the cementum and periodontal ligament, the cementum and the alveolar bone. Moving to the next question, the keratohyalin granules, they are basophilic in nature. Well, the keratohyalin granules, they are basophilic granules found in the keratinocytes. Keratinocytes, they are primarily found in the stratum granulosum layer. So these are the keratohyalin granules that you can see in the layer of oral mucosa. The stratum granulosum, it is the third layer of the epidermis. It provides the structural integrity to the epithelial cells. So remember, the keratinohyalin granules, they are basophilic. That means these granules readily take up basic stains in the histological preparation. The next question is the epithelial attachment it develops from, well, the reduced enamel epithelium. This one, the reduced enamel epithelium. It is the layer of epithelium that forms around the enamel of developing tooth. So during tooth eruption, this epithelial layer, it fuses with the oral epithelium. So the reduced enamel epithelium, what will do, it will come and fuse with the oral epithelium, contributing to the formation of the epithelial attachment. So the epithelial attachment, it develops from the reduced enamel epithelium. So this epithelial attachment, it is an important component of the periodontium that connects the tooth to the surrounding gingival tissue and provides barrier against the bacteria and other irritants. The epithelial attachment is through the fusion of reduced enamel epithelium with the oral epithelium. The lamina lucida, it contains type 4 collagen fibers and antigen bounded by KF1 antibody. So remember that for your exam point of view. Stratum lucidum, it is present in oral epithelium. The turnover time of time in oral cavity is slower than that of skin. So answer both the statements, they are false. The stratum lucidum, it is present in oral epithelium. This statement is false. The stratum lucidum, it is a distinct layer that is found in epidermis of skin, but it is not present in the oral epithelium. The turnover time in the oral epithelium, it is slower than that of skin. That is also false. In general, the turnover time of the oral mucosa, it is faster than that of skin, but slower than that of intestinal mucosa. So answer is D, both statements are false. The dentinal tubules that enter into enamel, they are the enamel spindles. The enamel spindles, they are the odontoblastic process. The dentinal tubules that enters into enamel, they are the enamel spindles. So these enamel spindles represents the odontoblastic processes and dentinal tubules that extends into the enamel. The epithelium of oral mucosa of the mouth, it is stratified squamous epithelium. So because it provides protection against the mechanical stress and abrasion, and it resists the penetration of microbes and foreign substances. So it is stratified squamous. The defense cells of the pulp, they are the histiocytes. The defense cells, they are primarily the macrophages. That are the histiocytes. The fibroblasts, they are not the immune cells, but they are the connective tissue cells that play a role in maintaining the structural integrity of the pulp tissue. The acinar lining of the major salivary glands, it is primarily lined by a simple columnar epithelium. So this epithelium, it is characteristic. It is responsible for producing watery, enzyme-rich saliva. So the cells that secretes various enzymes and proteins like the amylase, chelicarine, lactoferrin, lysozymes. So all these cells, they are important. So the most accepted theory of transmission of dental sensation is the hydrodynamic theory. So according to this theory, the dentinal fluids movement within the dentinal tubules, they stimulates the predentine, leading to pain receptors. In the enamel road, the direction of hydroxyapatite they are aligned parallel to long axis of enamel rod. The Hartwig epithelial root sheath, it is formed by cells of cervical loop. So the Hartwig epithelial root sheath, it plays a role particularly in shaping and formation of the tooth root. So the cervical loop, it is an epithelial structure located at the base of enamel organ. It gives Hartwig epithelial root sheath. The formative organ of dentine and primordium of pulp, it is dental papilla. So dental papilla, it is the part of tooth germ that gives rise to dentine and pulp. It is influenced by proliferative epithelium of enamel organ to initiate the dentine formation. The plexus of Rashko, it is present in which of following zones? It is seen in cell-rich zone. The histiocytes in the pulp, they are known as wandering cells, resting wandering cells. So they play a role in immune response and inflammation regulation. What is hypocalcified? This question has been already discussed. The answer is enamel lamella and incremental lines. During the cap stage of tooth development, signal for the cusp formation is controlled by enamel knot. So it acts as a enamel knot. It acts as a signaling for cusp formation during the cap stage of the tooth development. So enamel knot, what is that? It is a transient epithelial structure that plays a role in regulating the growth patterns of tooth cusp. The bacterial enzyme that is capable of altering ground substance in the periodontal ligament, it's the hyaluronidase. So it is a bacterial enzyme that is capable of altering the ground substance in the periodontal ligament. This enzyme, what it will do, it can degrade the hyaluronic acid that is present in the ground substance in connective tissue, including the periodontal ligament. The statement that is true about salivary peroxidase enzyme that is present in saliva, the answer is secreted by acinar cells of parotid and submandibular glands. So the option C is correct. Each of the following periodontal ligament, it is found with the central incisor except. The answer is interradicular. They are not associated with central incisors. They are interradicular fibers. They are associated with, remember, multi-rooted teeth, like the molars, to stabilize the roots. So answer is D. The enamel rod in gingival 1/3 of primary tooth, they incline. So as seen in the diagram, in the gingival 1/3 of primary teeth, they will incline occlusally oriented, and for the permanent they are horizontally or apically oriented. So this one is for primary tooth and this one is for permanent teeth. So these were the questions for your oral histology test. Thanks.